Webinars. Okay.
Oh, here we are.
Yeah. Hi, everyone, and welcome to the day one wrap up. I guess we'll just go around and introduce ourselves first.
Sure. Hi, everyone. Thanks so much for joining. My name is Kaleigh Beauvais, and I'm a recent graduate of the McMaster in Global Health program. That is my most recent background, and I also have a background in communications and international business. I'm really interested in working in humanitarian work and international nonprofit, non-governmental organizations. And I'm really excited to be a part of this conference this year. So thank you.
Great.
And I'm Lauren Hamill. I'm a second-year student at the Master of Public Health program at the University of Toronto, and I'm also specializing in women's health and global health. I'm a member of the CCGH Youth Planning Committee, and my interests in global health are in working on maternal and child health programs, specifically in times of crisis and conflict. So yeah, that's me.
Great. I guess I'll go next. My name is Grace, and I guess recently in terms of education, I've graduated from the Masters of Public Health program at U of T as well. So in the epidemiology stream, that was a couple of years ago now. So up until now, I've been filling my time working as a research coordinator at St. Michael's Hospital here in Toronto, and in some independent consultant work with Grand Challenges Canada and a couple of other organizations in the global health space. My interests and kind of where I currently am are in mental health and addictions, although I'm very interested in sexual reproductive health work, especially because of its direct intersection with human rights, advocacy, and global development governance.
Perfect. I'll go next. My name is Rima, and I am a York University graduate with specialized honors in health management and a certificate in health informatics. I'm very passionate about global health and women's rights, and I'm involved with Plan International Canada as a youth advocate. I currently work at a digital healthcare company and aim to help create a more inclusive community in regards to equal access to resources and opportunities, regardless of gender. And I constantly reflect on how the social determinants of health, such as education, play an active role in one's overall life. So all these sessions today with these different perspectives on a global health level have been super insightful.
Okay, so I think, did any of you get a chance to attend the plenary? I know I was able to catch part of it and just didn't know if anyone else had any thoughts, or maybe I was the only one.
Yeah, I was able to catch some of it as well. It was good. It was great hearing from Dr. Jane Goodall, like to talk about kind of the interplay of our relationships with the animals and the environment. And I found I really left the session thinking about the impact I make every day on the planet and like my role in the choices that I make in that impact as well. So I thought that was really important.
Yeah, I feel like she's really good at making us feel that way and think about how we are impacting our planet. She's really inspirational. Yeah.
Yeah, I think she finished it off with basically every day you wake up and you're making an impact. And I thought, oh God, yeah, that's right, I am. So I have to reassess for Jane. But I found it a really interesting plenary as well, and also made me think about, even not just in my personal life, but how the kind of concept of One Health sometimes, or at least, Lauren, I don't know if you found this in terms of our academic shared history, but even though it's super important and very relevant, it kind of gets missed, or that term was never really passed around in at least my epidemiology course. So I was thinking about how I needed to kind of reflect on that in the research that I take on, even if I feel like it's not directly within One Health as a field, how it's important to keep that in mind as I move forward in the research I'm doing.
Yeah, I agree for sure. And I think I'm in the social and behavioral health sciences stream of the MPH. So I find I have a lot more focus on the social determinants, and I've been lucky to get more of like the One Health perspective too. But I think that that's something that might be lacking in a lot of global health education. So I think that's something that we can take away as well from that session.
I agree with that. Yeah, absolutely.
Yeah, it really did make me realize that we all have an equal role to play, and we all should be contributing in some way as well.
Yeah. Yeah.
I know that I started off my day with the symposium on communicating innovative research findings to policy in a changing context. I have a dual screen because I took a bunch of notes, so I'm just kind of reading off some of what I synthesized in the last couple of minutes. But for those who might have also attended or interested in kind of learning what were some of the key takeaways from that session, there were a number of distinguished panelists who all had experience in trying to engage policy and decision makers in using evidence-informed like decision making in their process, and specifically focusing on West and East Africa. So these panelists included, and I will try my best to pronounce all the names correctly, was Dr. Bikaba, Dr. Godfrey from the Ministry of Health in Tanzania, Dr. Helen Agiba from the Ministry of Health in Nigeria, Patrick Magirwa from Partners in Population and Development Africa Regional Office, and then Ermel Johnson of the West African Health Organization. So all really focused on important maternal newborn child health examples in these regions. The kind of key takeaway that I found across all of their mini presentations was this idea of really engaging policymakers and decision makers in the research design process from as early as possible, which I thought was interesting because in theory that sounds very important, and then in practice I don't always see that in action. Maybe that's also just my place as an early career professional where maybe I haven't seen that level of engagement in the work I do daily, but yeah, usually I find it's within the knowledge translation strategy and kind of the dissemination where that comes into play. So it kind of brought up a lot of just thoughts and ideas around how that, like what that looks like in terms of engaging them from the design process in the beginning. And I would have liked to know more, and I'm hoping to kind of dig more into this on my own about what that looks like in terms of, do you get them in on the study design? Is it about what kind of measurement indicators you are looking to use? Are they a part of the M&E process? And just trying to kind of see how how their examples really point to integrating these decision makers throughout the entire process. And that was kind of shared amongst all 5 of the panelists. So a very important key takeaway. And another and another point around this was that it really leads to a shared sense of responsibility and kind of positions them as partners rather than as kind of like separate, like we are separate, that you are the policy makers and we are the researchers and we're trying to make this gap, but rather we are like building this bridge together. And an example from Helen, just trying to bring in a couple of examples of the work that they did, is when they did engage policymakers at the beginning of their one of their MNCH projects, MNCH and mental health. Now, because of the work and including them from the beginning, the mental health branch of their public health department is working very closely with another one of their departments, that is the Department of Planning, Research and Statistics, to ensure that they include a broader set of mental health indicators in the next review of their tools. So whether they're NHMIS tools, which I haven't had a chance to look up yet, but I'm assuming it's around kind of like national health indicators and surveys. So that was one example of where they were really able to cross collaborate based off of the fact that they brought in a bunch of policy decision makers with the research team from the get-go. And I want to keep us all on time. So I'll just say one other thing very quickly is that it was also brought up that while it's important to engage from the beginning, during a crisis, there's a specific notion that stood out to me that you need to incorporate mitigation efforts into your innovation. So how do you adopt and accommodate new methodologies in the work that you're doing when a crisis in this kind of example around COVID takes place, and maybe redirect some of the resources or priorities elsewhere away from your own work. And kind of ultimately a reminder to everyone is that it's important to accept the changes for action, even in small doses. So, sometimes we look at it as an all or nothing. It all happens or it doesn't, and it's a failure if it doesn't, and it's a success only if it's all implemented. But really, there's something, yeah, exactly. There's something to be said about the value of the small steps. So that was kind of just my quick summary of that symposium. I don't know.
Summary.
Thanks.
Great.
That was great. I think I'm looking at our little schedule here too. So I tuned in for the humanitarian response to COVID-19, and that was one of the concurrent sessions at 11. And Lauren and I think we were both interested in this. So jump in whenever. So that was moderated by Yipeng Yi, and he did a great job and asked some amazing questions. I also have a dual screen going here. So so in this session, just a little recap, was Amy Kipp from the University of Waterloo, Jessica from CanWatch, Jessica Fern from CanWatch, Red Kabata from Nepal Red Cross Society, and Rebecca Davidson from Care Canada. And so really the most interesting thing I noticed overall, there was a lot of similarities in what they were all saying. One of Yipeng's questions was, how has COVID impacted your work positively? And I thought that was a really interesting way to take what's been happening with COVID and spin it, and like, how has this helped? How has this changed us in global health? And so Amy had said there's actually more, it created a lot more opportunities for collaboration, which is completely true. And just like what you were saying, Grace, like it's more intercollaboratory between different sections and different organizations. She said they've been piloting new methods for online platforms to be used to communicate more about what's happening, problems in response to COVID. And it also allowed people to become more flexible and adaptable to what's going on in their situations. And so that was kind of echoed through each response in how has COVID impacted positively. So even though, of course, COVID's not a positive thing, it's changed the way in which a lot of organizations have worked. And Jessica from CanWatch said it's built more creativity and adaptability. So similar again. So I thought that was really positive in that sense, because it's going to help us in the future for future pandemics. Hopefully there won't be, but should they come, which they most likely will, this will help organizations to build on that and work together in the future. And I thought that was really great. And they had some really great things to say about that. I don't know, Lauren, if you wanted to say anything, but
Yeah, for sure. So I agree. I really like the question regarding some of the positive impacts of COVID. Not that there's many, but just I think it led us in global health to kind of think about solutions in new ways. I think a big challenge in global health is always coming up with new innovations and adaptations. And I think a main takeaway of that session was just the overall importance of adaptation and innovation in the face of certain emergencies like a global pandemic. And I think this was shown by the use of mobile phones, which I think should really be kind of expanded in general in global health to improve like tech equity, but especially in the face of COVID restrictions. So I think that's been a really good opportunity, implementing more like cell phone usage in different programming. And I think countries susceptible, I think another important note was that other countries are susceptible to other natural disasters like year round all the time. And they're now also dealing with COVID on top of existing emergencies. So I think it's really important not to forget that as well. And then something else just kind of interesting that I took from this session was a new word that I learned, which was COVIDization. I hadn't seen that used before, but I feel like I'll be using it a lot lately as COVIDization of the global health sector just kind of continues and probably will continue with the more long-term impacts as well.
Yeah, absolutely. I'm going to use that word too. Kind of just summarizes everything.
Yeah.
Definitely. I wish I had also attended that session. If only there was a way to have the dual monitors and two people. Yeah, I think that's a really great way to pose a question of like what have been the positive impacts, even if it's just to help us reframe the work that we now find ourselves doing or the situations that we're in, because despite it being ultimately a very stressful and difficult time to try and navigate, it's nice to be able to kind of hear what other individuals have found to be helpful and successful in kind of moving themselves forward, even if it's maybe not what was originally anticipated. Which always provides me with a bit of hope, considering some days I'm always like, what is the point? I don't understand what's happening. Yeah, but that was very helpful to hear.
Yeah, exactly. I think that's a great way to frame it. That sense of like that positivity gives us that spark of hope that like there are also good things coming out of it as well.
Yes. What was I say? Oh, Kaleigh, did you want to go next, or do you want me to go next for the?
Yeah, I can go just quickly. I just also wanted to mention that actually all the sessions will be on the agenda by tomorrow. They recorded everything and they're putting them up within 24 hours. So actually we can go and rewatch any sessions that you missed. And they'll be available for a month post-event. So just in case anybody was thinking, shoot, I wanted to watch that, you can. Just so everybody knows. I'll just say a quick note before Grace, you touch on yours. I also attended the oral session on the innovation in response to COVID-19, which kind of ties in to the humanitarian response to COVID oral session, because again, it talked about what has come out of this COVIDization of our globe. So there was a couple of things. The first session was from COVID-19 in India, or sorry, the first speaker was COVID-19 in India, and then the last two were Canadian Red Cross. So in terms of COVID-19 in India, they're using interactive voice response platforms. So that was new that came out of that. People can call in if they have a mobile phone, but you don't need internet access or anything like that. And you can tell these platforms what whoever's listening to this, what you need in terms of, I need more food, or I need food for my farms, or I need this, and they'll listen to that and see how they can allocate funds towards you. So that came out of that. So that was really great in terms of innovation because of COVID-19. Then the Red Cross, this was so fascinating to me. The Red Cross Canada, it turns out there's a ton of international medical graduates in Canada. So they call them IMGs. And these are people that have their degree, professors who, or sorry, people in the profession who've done their training just overseas, but it's not recognized here. So you have a ton of people with medical knowledge, masters of public health, absolutely so much information. However, they can't get into professions here in Canada. So they're working as cab drivers or something that's not in their field. So because of COVID, Red Cross put a call out to see international medical graduates and utilize their abilities to help during COVID, to respond to long-term care homes, to respond to the migrant worker problem. And it gave them employment opportunities that they would otherwise would have never had, even though they have so much qualifications to do this stuff. So I just thought that was fascinating. And again, like Lauren, you said, not a ton of positives that come out of COVID, but that to me is really fantastic. Sorry, Grace, I took up a ton.
No, that was very interesting, and it like sparks a bit of like passion in me when you were getting so excited about that, because
It's great, it's amazing.
it is.
And then there's so many people that are so smart, and it's like, why are we using you?
Exactly, and it's kind of maybe, if anything, enlightening to the fact that at least COVID is kind of forcing a hand, like what is really not possible and what is just viewed as not possible because no one wants to change the status quo.
Totally.
Like, and I think that is a perfect example of being like, we have capacity, we have opportunity, we have need, and like we can fill those can all come together. And unfortunately, it takes something like this for that to happen. But now it's the perfect kind of like platform for going. We can't go back and be like, it doesn't work. It's not possible, because we now have to show that nope, it works, and it's important to utilize people and leverage their capacity and especially their unique perspective as individuals who've likely practiced as well as studied in various contexts.
Absolutely.
So yeah, a very, very interesting and cool session. Also, now I will go back and watch this.
Yeah, it honestly is great.
For sure. And yeah, on that note, kind of around networks and kind of leveraging various organizations, I was in the symposia for linking knowledge and expertise to enhance climate change related health research and practice. Admittedly, my own COVID downfall was my internet, so I only caught the last half of this section. But from what I did catch, it was around like what is a community of practice, and how can you create one, and just some examples. So just kind of from what I was able to grasp, the community of practice is a group of people who share a concern or a passion for something they do and learn how to do it better as they interact regularly. And so in this case, there was the two that I were able to kind of catch were HEART and the BC Coalition Institute, both around HEART was, I don't remember the full name for that acronym, but it was around medical student. It was the Canadian Medical Students Association having a network of individuals and medical schools that were interested in basically best practices related to climate change and as medical students. And so their kind of main reflections were around the importance of developing this community of practice, reaching out and extending their network beyond who they know to include, like leveraging other already established networks. For example, they worked together with this organization in Australia called Code Green to develop a webinar together on influencing planetary health action. So a great example of leveraging multiple networks, and also kind of the main takeaway. And there was a really good discussion around this, was around shared goal setting and making sure that that was really something that each member, whether that was an individual or an organization, kind of worked to and collaborated to develop together. So even though you're all working in your own separate organizations, you still have this common goal that guides your community of practice. And that was kind of like the one main key takeaway that I got from that, as far as what I understood. And I'm just keeping an eye on the time, and I want to leave lots of space for Lauren or Rima, as well as the last reflections, but I would recommend going back to that session because it was very interesting.
Cool.
Yeah, so the last session I attended today, and I think Rima did as well, was the session on gender equality and sexual and reproductive health and rights in Mozambique. And so they had representatives from a couple of different organizations, the Aga Khan organization, Plan International, and Save the Children. And this one was about the gendered effects of climate change related natural disasters in Mozambique and the different programs used to support women and girls. So I thought this was a really good perspective, just because women and girls are so differently impacted by natural disasters, by COVID even, now. So I think a big takeaway was me to remember that even as we work to stop the regression of the rights of women in light of COVID-19, we will also be faced with emerging climate change disasters in the future that will also put pressure on girls' rights. So we really need to continue on with adapting new solutions and really focusing and incorporating gender equality work right into disaster management and humanitarian responses. So again, just the focus is really needed on innovation. And while today this was about Mozambique, more countries may also experience the interplay of natural disasters and climate change. So we really need to learn from countries like Mozambique with their experience, and just to continue to collaborate like interdisciplinarily and share lessons learned from COVID, from like climate change related disasters, so we can keep coming up with innovative solutions. So I think that's an important thing too. And I think a big part of preparedness will be mainstreaming disaster risk reduction right into development programs. I think there's some gaps related to that. And I think moving forward, that will be important as well. And then just a final thought before I let Rima mention some things as well. I think we need to continue to push that like sexual health and reproductive rights are vital services. Like they cannot stop even during disasters and global pandemics. Women and girls will continue to need access to feminine hygiene products and proper hygiene, contraception, safe family planning, medical testing, and support for domestic violence, among so many other things. So I think we need to continue advocating and pushing for this messaging, because crises don't stop these very important needs and services. So,
Well said, yeah.
Yeah, that's great. I definitely agree that we just have to work harder at creating these solutions. And it was learned in the sessions. There were so many examples provided, which made it clear that conflict increases gender-based violence and also increases the inequality that's already present. So it's really important to take that into consideration when creating these solutions. And also, as learned in one of the sessions, conflict has made it even more difficult to access certain resources, just like Lauren previously mentioned. So like access to menstrual hygiene products for adolescents, for example. These resources are limited to begin with, and with the Kenneth cyclone, it made it even more difficult to access these products. So this just made me reflect on everything that's happening right now, and also how we need to continue adapting to these unique changes to create appropriate solutions. And just one more last thing that I'd like to echo that was mentioned was it really stuck out to me that whether it's climate change or conflict, like Lauren mentioned, sexual and reproductive health rights and services are services that shouldn't be stopped and can't be stopped because of other issues, really. So we just really have to get even more creative to make sure these services continue in the best way possible.
Totally. Yeah, I think that I like that thread of creativity and like adaptability can be seen from throughout all the sessions that we've recapped, and is very inspiring and helpful moving forward. I don't know if we have enough time to go over the plenary. If anyone wants to throw any last kind of thoughts out before we end our daily wrap up.
One final thing that I thought was really interesting from the plenary was just the notion that like the world has never been so interconnected. So we really need to use this to our advantage and continue to collaborate while talking to more people and talking to people that are different from us. And I think that's so important, and we need to really take this opportunity of being so interconnected and everything being so virtual to really continue to connect with people from even different sectors and like multidisciplinary teams.
Absolutely. I think that's a really good point.
Yeah, I agree. It's so important to, like, at a time like this, we can't do this alone. So I think from all the sessions that we attended, I think the theme of it was that collaboration is so crucial, especially at a time like this. And it's important to partner where we can to make use of our resources collectively. And like we all share vulnerabilities all around the world. So it's important to work together to create these solutions together instead of doing it separately, for sure.
Yes, definitely. And I think kind of piggybacking on that kind of concept that all the panelists kind of suggested as a take-home message for the plenary was basically, do we always need to reinvent the wheel? know where can we use already established workable or at least piloted practices and in different settings, and that kind of like pairs nicely with the collaboration component that you're just talking about, which I thought was really important to mention as well.
I think that's time. Thank you so much, everyone, for tuning in.
Yeah, thank you. It was lovely to chat, and have a good rest of your week with the conference.
Absolutely.
Yeah, thank you so much, everyone. I hope you enjoy the rest of the conference.
All right.
Yeah, thanks, everyone.
Thanks.
Take
See
care.
ya. Bye.